Welcome back to The Explainer. Today, we're tackling a really high-yield topic for your exams, Hydatid Cyst. We're going to break this down so you can absolutely master it, from the life cycle all the way to treatment.
All right, so think about this for a second. A dog, a sheep, and a cyst. A cyst that can just hang out inside a person growing silently for decades. What's the link? Well, it all comes down to the life cycle of one tiny parasite. And honestly, if you can wrap your head around that cycle, you've pretty much cracked the code for this entire topic. So let's dive right in.
Okay, first things first, let's get the definition down. What exactly is a hydatid cyst?
Right. Here is the first major point you absolutely have to nail for your exams. The disease in humans, it's not caused by the adult tapeworm. No, it's caused by the larval stage, which is the cyst itself. I can't stress this enough because it's a super common mistake. So let's just lock that in right now. Larva, not adult worm.
And just look at this. It's pretty incredible, right? On the left, you see the adult worm. It's tiny, like just a few millimeters long, chilling in a dog's gut. But then you look at the right, and that is the monster cyst it can create inside a person. It's such a stark contrast, isn't it? Really shows how a tiny little parasite can cause a massive, massive problem.
Okay, so how do we even get infected? To answer that, we have to follow the parasite on its journey. The life cycle is everything, you guys. If you get this, you'll ace the questions on transmission and prevention.
All right, here it is, the whole life cycle. Now, I know it looks a bit busy at first glance, but don't worry, we're going to simplify it. Just take a look. You can see the main characters, right? The dog, that's our definitive host. Then there's the sheep, the intermediate host. And then, you see us, humans? We're way off to the side, labeled the accidental host. See how we're kind of a detour? Okay, got that basic layout? Good. Now let's make this super easy to remember with a couple of mnemonics.
So the whole thing kicks off with the dog. And here's your first mnemonic, it's a lifesaver. Dog defines. Just burn that into your brain. Why? Because the dog is the definitive host, where the adult worm lives. So the dog literally defines the life cycle. Simple as that.
Okay, now for the intermediate hosts. The sheep is the typical player. But this is also where we, humans, accidentally crash the party by swallowing the parasite's eggs. And the mnemonic for our role? It's a little harsh, but you'll never forget it. Man is a mistake. Think about it. For the parasite's life cycle to continue, a dog would have to eat our infected organs. Since that doesn't happen, the cycle just stops with us. We're a dead end, a mistake in the parasite's master plan.
All right, so we know how the cyst gets there. Now let's zoom in on the cyst itself. We're going to look at its structure because that's what directly leads to all the signs and symptoms you'll see in a patient. This is pure pathology meets clinical medicine. I love this slide because it shows the theory versus the reality. On the left, you've got your standard textbook diagram, but on the right, that's the real deal under a microscope. And you can actually see that inner germinal layer doing its thing. It's budding off and making those little brood capsules. It's like we're looking right into the parasite's little factory. Okay, exam mode on. You have to know the layers of this cyst. No excuses. But don't worry, the mnemonic is super easy to remember. P-E-E. P for pericyst, E for ectocyst, and the other E for endocyst. Now, here's a critical detail. The pericyst on the outside, that's us. That's our body's own fibrous tissue trying to wall it off. The ectocyst and endocyst, though, that's all parasite. And that inner endocyst, that's the real problem, child. It's the germinal layer, the factory floor, churning out baby parasites and that super antigenic, toxic hydatid fluid.
So how does this thing actually cause problems for a patient? Well, it really boils down to two main pathways. The first is just a space problem. This cyst is a slow-growing balloon, and as it gets bigger, it just swishes stuff. It puts pressure on the liver, the lungs, the brain. You get what they call mass effect. That's scenario one. Scenario two is the big one, the catastrophe. The cyst bursts. And when it does, all that toxic antigenic fluid we just talked about spills out. That triggers a massive system-wide allergic reaction. We're talking full-blown anaphylactic shock.
Okay, so you've got a patient, you suspect this might be going on, but how do you actually find this thing? How do you diagnose this hidden enemy?
So we've got a whole toolbox of diagnostic methods here. You can see we can do microscopy, serology, even molecular tests, but look what takes center stage: imaging. And there's a really good reason for that. When it comes to hydatid cysts, seeing is believing. Okay, everybody, lean in for this one. I am practically guaranteeing you will see this on an exam. Ultrasound is the #1 choice for diagnosis, and you must know the WHO classification. It's how we figure out if a cyst is active, dying, or totally inactive. Now, if you're cramming and can only remember one thing from this table, make it the water lily sign. It's the classic finding for a CE3 cyst. It's when the inner layers detach and float around inside the fluid, kind of like a water lily on a pond. It's a beautiful image for a pretty nasty situation.
And here's what it looks like on a CT scan. This is an inactive CE5 cyst. The dead giveaway? Look at that thick, bright white ring around it. That's calcification. It's basically the body's scar tissue, its victory wall, saying, we've contained this thing. When you see this, it tells you the parasite inside is probably dead, and this is just the leftover shell.
Now, a quick heads up. If you're reading some older textbooks, you might come across something called the Cassoni test. It was a skin test, but the key word here is was. It is totally obsolete now.
So why'd we get rid of it? Well, for one, it wasn't very good. It had low sensitivity and tons of false positives. But more importantly, it was dangerous. You're literally injecting a bit of the hydatid fluid into someone, the same stuff that can cause anaphylaxis. Not a great idea. Now, here's your pro tip for oral exams. While it's obsolete, a classic examiner might ask you about it just to see if you know your history. So make sure you know what it was, and even more importantly, why we threw it in the trash.
Okay, so we found the cyst. Now what? Let's talk about treatment, and then we'll wrap up with how to prevent this whole mess from happening in the first place. These days, we don't always have to do a huge open surgery. For a lot of these cysts, we have a much smarter, less invasive option called the PAIR procedure. And the name is perfect because it tells you the 4 steps right there. Puncture, aspirate, inject, and re-aspirate. You go in with a needle, pull some fluid out, inject something to kill the parasite, wait a few minutes, and then suck it all back out. It's pretty slick.
So PAIR is one tool. What else do we have? Well, the main drug you need to know is albendazole. It's our go-to. We often use it alongside a procedure like PAIR or surgery, both before and after, to kind of mop up any stragglers and prevent recurrence. Of course, big surgery is still an option for really complicated cases. And remember those inactive calcified cysts? For those, a lot of the time we just watch and wait. If it's not causing problems, why poke the bear?
And here we are, right back where we started, the life cycle, because at the end of the day, prevention is just about breaking that cycle. And we've got one last mnemonic for you, and it's the most appropriate one yet. DOGS. D for deworming dogs. O for observing personal hygiene, like washing your hands. G for guarding sheep. And S for stopping stray dog populations. It all links back together perfectly.
All right, we've covered a lot of ground, so let's boil it all down to the absolute must-know facts for your exam. Get your phones ready, because you're going to want to screenshot this. There it is. This is your golden ticket for last-minute revision. Seriously, if you can walk into your exam and confidently state these 6 points, you are in fantastic shape. This is the heart of the topic. So, now that we've mastered this one, what should we tackle next? Let us know in the comments which tricky parasitic life cycle you want us to explain.